This is 3Q's Interviews. We're here with Dr. Go. Dr. Go and I met many years ago, and he's part of the reason why I'm interested in going into medicine and going into surgery. Dr. Go, would you like to introduce yourself?
Sure. Hey, everybody. My name is Michael Go. I'm a vascular surgeon. I'm an associate professor at The Ohio State University. I love it here, and I love what I do.
Fantastic. Can you explain kind of why you chose to work in vascular surgery? How did you find that field?
Sure. Well, as I was in medical school, I didn't come in with any preconceived notion of what I wanted to do, and I just sort of went in with an open mind to all the rotations. In those days, we didn't rotate until you were third year, and I was one of those students that I just loved every rotation. You know, I remember I started with psychiatry, and I thought, man, this is great. I want to do this, and thank goodness that didn't happen. But and then as soon as I had a surgical rotation and had an experience in the operating room, that was sort of it. And that's a pretty common story, I think, among medical students. I just knew, okay, I want to be part of this operating room team. I want to do surgery. And so actually I was going to do GI surgery and did all my research, did a full year of basic science research in GI oncology, and then first rotated as a chief resident on the vascular surgery service, and I just loved the technical aspects of some of the operations I was exposed to, then sewing on blood vessels and things like that. And then from there I just sort of learned what all was involved with vascular surgery and started to find that I liked every aspect of it. So that's how I came to do vascular surgery very late in my career, actually, as a fourth year resident is when I decided to do that. So.
Well, that's good to know that
Sure.
you don't have to make a decision that early on. You still have time to make decisions and end up where what fits you best.
Yeah, that's true. Although times are a little bit different now. So now you can do vascular surgery. I did it after a general surgery residency. Now a lot of young people will do vascular surgery straight out of medical school. Mm-hmm. So you have to know a little bit ahead of time. But there are still multiple pathways to do it. So.
Fantastic. So what does a typical day look like for you, or kind of your myriad of days?
Let's do a typical week, because a typical day is sort of hard, but I typically have 1.5 days of clinic a week, so all day Monday and a half day Tuesday. Half day Tuesday I have a specialized what's called a limb preservation clinic, where I work closely with podiatrists and diabetologists and prosthetists in a clinic where we specialize in taking care of people with peripheral arterial disease that causes risk of losing limbs. Mm-hmm. And then the other 3 days, 3.5 days, I am either in the operating room or I'm in the cath lab or angio suite. So in vascular surgery, we do open surgery in a regular operating room, but we also do minimally invasive catheter-based procedures in a cath lab or a radiology suite, for example. So
that's fantastic. So how closely do you work with other specialties like radiology?
Yeah, that's a great question. One of the things that's unique to vascular disease is that lots of different specialties work in the field. So cardiologists take care of vascular disease, vascular surgeons take care of vascular disease, sometimes interventional radiologists do for sure. When you're talking about aortic disease, sometimes cardiac surgeons also are involved too. So it is a very multidisciplinary field. In my local environment, it's very collaborative. I work very closely with all those specialties. I think that can be different depending on where you are, but in general, I think the more people that are open to collaboration, the better outcomes for patients. So yeah, we do work very closely together with multiple specialties.
So somebody that might be interested in vascular surgery, as far as the landscape of who does what procedures in what region, is there any way to predict if you want to work maybe on the East Coast, you want to work on the West Coast, or you have a specific area in mind? Is it possible to work there if maybe vascular surgery or some of those procedures are covered by different specialties? Do you know how planning that works?
I think another way to look at it would be people who are drawn to vascular surgery want to be able to offer complete care, head to toe, beginning to end, through any complications or successes for vascular disease, right? And so, for example, if you're strictly a cardiologist or an interventional radiologist, you wouldn't be able to offer somebody surgery if surgery was the better option for a particular disease. If you were just a vascular medicine specialist, so you'd have a lot of experience treating folks with medication, therapies, and other treatments, but no procedures. And so a vascular surgeon is actually the only specialty who can offer the whole range of treatment. A common disease we take care of is blockage of the arteries in the leg, something called peripheral artery disease. Many times you can treat that percutaneously or minimally invasively with stents or angioplasties or other devices. But sometimes you do bypass surgery too in an operating room. And so unless you're a vascular surgeon, you can't offer both of those treatments. And as a result, there may be some bias as to what you offer the patient. The great thing about doing vascular surgery is you really have the skills to offer all kinds of treatments and then can focus on, all right, which one is the best for this particular patient. And the surgeries, the treatments can be medical therapy, so we give medication to patients who have pain from walking from vascular disease. We also do tiny little procedures such as varicose vein treatments, and we do big, complex, open thoracoabdominal aortic surgeries too. And so it's the whole gamut, every part of the body.
Yeah, that's quite the range there for procedures. Okay, so we'll do our 3Q's part of the interview. Question number 1, what is a common myth or something that your patients kind of present to you that you like to dispel?
Sure, so probably the most important myth in our specialty is that most of the lay public doesn't know what vascular surgery is. If you go to a cocktail party and people ask what I do, I say, well, I'm a vascular surgeon. They think either I take care of varicose veins in women or I do cardiology. And both of those are true, but there's a whole range of other diseases that we take care of in vascular surgery, such as stroke. We take care of strokes caused by carotid artery blockage. We take care of something called an aneurysm, which can occur in the aorta, either in the chest or the abdomen or elsewhere in the body. We take care of lower extremity blockages, peripheral arterial disease. And there's a whole bunch of other more esoteric things we take care of too. In oncology, sometimes there's need for reconstruction of blood vessels. In orthopedics, there's need for exposure of the spine, so the spine surgeon can do what they need to do. A whole host of conditions that vascular surgeons are equipped to take care of.
Excellent. Question number 2, what is a piece of advice for a medical student that maybe wants to get into vascular surgery that they should start doing early, or something that can help them?
I think the biggest thing is just to get exposure. You know, these days in medical school, it seems that you have to make decisions pretty early based on just exposure to the 4, 5, or 6 core clinical rotations. But if you have a specific interest in vascular surgery, call up any vascular surgeon, shoot them an email. They would, I guarantee you, they would love to have you visit, do a research project such as the one that you did with me, shadow in the operating room, or just talk. Our specialty is very keenly interested in recruiting high-quality students, and so I guarantee you, if you call a vascular surgeon, they would love to have you.
And question number 3, what is your kind of favorite procedure or something that you really enjoy doing?
You know, the favorite thing that I'm doing now, actually, more than a procedure, is that Tuesday limb preservation clinic I talked to you about. I think since probably the last time we really spoke in depth, it's become a clinical and a research interest of mine. The reason why is that that disease, the wounds on the leg from lack of blood flow, it disproportionately affects low-income, disadvantaged patients, and it also is related to diseases that are hard to take care of, such as diabetes and kidney failure. And so I'm really proud of the effort that we've put together to make things as easy as possible for these patients with this complex disease in the specialized clinic that we have here at Ohio State. And so, you know, I think when I do procedures involved with those patients, whether it's angiograms of the leg or bypasses of the leg, and I get to talk to them and their family and we have a good outcome, that's my favorite thing.
That sounds awesome. That sounds really cool. Yeah, and that is something new. I didn't remember talking to you about that before.
Yeah. Probably in the last 7 or 8 years.
It's a great development.
Yeah.
All right, well, Dr. Go, thank you very much.
Absolutely, Spencer. Great to see you.